Ďakujem. I would like to talk Mr. Mishev, yeah, from Bulgaria, which will talk about his success and with Ngenuity system. Here, the first.
Dear colleagues, thank you for having me here. I want to thank Alcon for inviting me to present about the Ngenuity. And the title of my talk is how transitioning from analog view to the digital visualization has changed my work. These are my disclosures. And I would like to start with what is the Ngenuity. The Ngenuity is the only system at the moment which is with high dynamic range camera. What is the meaning of the dynamic range? The dynamic range is the ability of a single pixel of the matrix of the sensor to capture the lowest light data and the highest light data, meaning that you need to perceive that as a window of acquisition. We all know that during vitreoretinal surgery, there are areas where there is not enough light and we have a lot of shadows. Still, with high dynamic range, we might see details, and vice versa, where we are close to the retina, we have flashes. Normally, we see them like white spots when the camera cannot capture this image. So, the dynamic range is important. In this slide, you can see the human eye dynamic range is roughly 100 decibels. Regular DSLR, you have 40 decibels. Professional cinema camera has 78 decibels and the Ngenuity has 85 decibels. So we can assume that it's closer to the human eye. There is another thing which is absolutely related to the presbyopic age for some of us, and presbyope already. The overall depth of field or depth of focus of the microscope is dependent from the accommodation of the surgeon, meaning that younger surgeons will have more depth of field than surgeons which are in presbyopic age. When you have an Ngenuity system and you are looking on the screen, you are actually using your far vision and you are independent from the presbyopia. We all know how difficult it is already to focus during loading the lens or in anterior segment where we need to continuously refocus the microscope up and down because our presbyopic changes has diminished our accommodation and we have less depth of field while looking through the oculars of the analog microscope. So this is an example of the depth of field of the microscope with Ngenuity camera. This is obviously retinal detachment, but it is observed through anterior segment approach. So we can see the anterior segment structures, but we can see fairly well the underlying retina. So this is, of course, made on purpose just to demonstrate how much depth of field you might have with the Ngenuity system. So why don't we go a bit beyond the analog microscope? We can use less amount of light because the high sensitivity of the camera. We don't need to refocus, as I said, about the instrumental presbyopia, and we don't need to use multiple screens in order to see additional data. For example, we have already built-in data fusion. If we are working with Centurion or with Constellation, we can see everything on the screen. Also, we can input outside sources in a picture setting, so we can see, for example, OCT or endoscope or something else that we might need to see during the surgery. So, what we see with the analog microscope? Just one eye, and actually there is no fair comparison in between the Ngenuity digital image and the classic color analog view. Why? Because there is not much of a difference actually if it's a color image. But if we compare the analog microscope with Ngenuity, we will see immediately the benefits. 5 times extended depth of field and 42% increased depth resolution. What is the meaning of the depth resolution? It means that in the all depth of focus range, we have equal focus and resolution. So this is important for visualizing the details. And this is the next step. Now, you remember the analog color view, which is in the center, and we have additional, at the moment, 8 imaging modalities that might provide us with additional information. Why? Because the digital image is composite image. So with digital camera, we can decomposite this image. So we can use certain wavelengths to highlight structures of interest. For example, here you might see anterior segment filters, which are related to fundus and contrast, and posterior segment ones related to intraoperative fluorescein angioscopy, ILM enhancement filters, and fluoroscopic diffractomy. So this is an example of fundus enhancement filter. You might see the regular image and the appearance of the lens, and while we are chopping the lens, normally we lose the visibility. And when we engage the enhancement filter, we suddenly start to see transparent pieces. Why that is important? Because I can judge and I can see how deep I can go with my instruments, and ultimately it provides me with a safer surgery. This is contrast enhancement filter. This is regular view. This is overexposed regular view. This is another one, fundus view, and this is contrast enhancement. It provides a more detail and color separation in between tissues with similar transparency. Again, the aim is to see more details and to work more safer. Also, you can appreciate the level of magnification here. You can evaluate the texture of the tip of the instrument. In the past, there was a latency. Nowadays, this is not the issue. Would I allow myself to tease the capsule like that if there was a latency in what I see and what I'm doing? So nowadays, this is not the issue at all for the Ngenuity. This is something which I wish to happen, and I want to have an area of interest filtering, because to now we are filtering all the image, and we lose a lot of data in the limbus, for example, or in the conjunctiva. If we have the area of interest, in that case only the fundus reflex, and the rest of the eye to be perceived or represented as a normal color, it will be more easier for us as surgeons to comprehend what we are looking, because sometimes we need to somehow escape from the habit to see the normal colors of the eye tissues. With the digital imaging, we might see different colors which will highlight more details where we need them. For example, here you can see the normal view. This is a video achieved with mounting the two Ngenuities on the same microscope on optical stereo bridge, just for the sake of demonstration of the digital filter. So you can appreciate if the fundus reflex and the contrast of the capsule is enhanced or not compared to the regular view. So I think there is obvious difference here. Then we can use it in glaucoma surgery. If we apply a certain digital filters on the angle, we can see certain anatomical landmarks more detailed or more easy. And especially for angle-based surgery, I find this beneficial. And last but not least, this is something quite new, and it's called intraoperative fluorescein angioscopy. And it is achieved in real time. This was a case of a hemophthalmos due to advanced HRMD. The purpose here is actually to see the image The image is quite good, and it is absolutely similar to what we are used to with our fundus cameras, and it is intuitive during the surgery to interpret where are the areas of ischemia or where are the areas of leakage. So the ingenuity from visualization system becomes diagnostic tool and even navigational device. Why? Because, for example, with diabetic retinopathy, we might guide our intraoperative laser according to the areas of ischemia and to be more forgiving to the already damaged retina. Thank you.
Thank you so much for a beautiful presentation. I am very happy that you are here. I worked with this system, but it was a previous version with some delay, and it was not so good. But now I see that it works very, very well, very perfect. And there are many, many possibilities for visualization of ocular tissues. Congratulations.
Good morning. You started to persuade me to use Ngenuity because we have the possibility to use it, but we didn't, we weren't so confident about using it. The angle surgery is the one which persuaded me actually because we would like to use hydrus, which I think was implantation in your video. And I would like to ask you, what was your learning curve to be really comfortable in using it and to say that this is good? How long did it take?
I started in 2018, and it took me like 6 months to transition from every procedures to the heads up. I mean, I do anterior segment, glaucoma, trauma, and posterior segment surgery. So 6 months is a period that you might need to adapt to it. Yeah.
And did you start with the anterior segment, I guess, and cataract surgery, or the posterior?
What is interesting is that the posterior segment surgery is a bit easier, probably because we don't have so sudden and fast movements. I would
because
advise,
it's more stable, yeah?
Yeah, I would advise starting by suturing with the 10-0 nylon grapes, cherry tomatoes, and things like that, just to get the dexterity and the habit to not look in your surgical field, but to look on the screen.
Yeah, I think it's a big difference when you're used to use the microscope and now you have to swap. But I think it's not so big learning curve, 6 months, so it's fine. So maybe we can try also.
It depends. If you're a gamer, for example, you might be faster.
No. Okay. No. The angle surgery is really a very complicated surgery because, to do it in the microscope because you need both hands and you need to visualize the angle. And when you do by the other hand, the entrance into the Schwanz canal. So it's really, this is the thing that persuaded me today. Thank you very much for your presentation.
For me, on the angle surgery, the biggest problem is the visualization, actually.
Yeah.
Nowadays, with the volume ready, which will free your second hand, it will be even easier. And when you have a good visualization, I guess our results will be better.
Yeah.
Thank you so much.
So when I saw the system, it was very comfortable, and one of the disadvantages besides this, what we heard, is that we take care about our health, and it's really comfortable for our back. Because one surgeon explained me that he started to use this system because his teacher had to stop surgery at maybe at the age of 60, and he doesn't want to be the same one. What do you think about this?
You're absolutely right. It extends our lifetime as surgeons. If you, for example, have a back pain issues, it will be certainly better for you to do a heads-up surgery instead incline to the ocular, so they.
This is a big advantage.
Absolutely, absolutely. Thank you.
So thank you very much for the presentation.